Hello, good evening, everyone. Please, if you can hear me, kindly type in the comment section so we can start the class. Thank you. All right, thank you very much for joining us tonight. A quick introduction. Well, I'm Samuel Yeni, a graduate nurse from Ladoke Akitola University of Technology, Gumosho, Oyo State, Nigeria. So I and my friends came together bring um to bring to you this training, this bootcamp. So you are welcome to Nurspal Research Bootcamp, the January edition. So we are trying this for the first time, and hopefully it will be something we are going to continue. You understand? It may not only be research alone, but with time, we believe that we'll be able to go into other aspects of nursing. All right. So today we are going to be looking at topic selection and approval strategy. Topic selection and approval strategy. This is the first thing we actually do in research writing. You need to be able to first pick your topic. For those that are preparing for council examination March and May, then they will be they will have to submit their topics. Most of the time, your supervisor requests for 3 topics, you submit 3 topics. Then after doing that, you they approve one for you. Then you begin to write. But then most of the time, there are some supervisors that will be like, no, your research topic is still not okay. So that's what we'll be covering today. How they select those topics, how you need to frame your topic so that your supervisor can actually pick it. So let's start. What is a research topic? A research topic is a specific measurable statement. We need to take note of that word specific and measurable. It is a specific and measurable statement that identifies a relationship between concepts within a specific group of people in a specific location. So what a research topic is actually different from a let's say a subject. We are still going to get to that because okay, let's proceed so you can see now subject versus topic. Now for example, now diabetes mellitus is a topic. It's under method, you understand now. So you now want to write a research and then you now say that your research topic is diabetes mellitus. If you come back here, you will see that that diabetes mellitus is not what? It is not specific at all. It is actually not specific. So diabetes mellitus is actually very large. It is very broad. You cannot research everything under diabetes mellitus. We have types of diabetes mellitus. Even that one alone is something that will take much of your time. For example, the types we have in bracket, I wrote ABC, autoimmune condition, then body response. That's the type 2. Then the third one, C, is carrying for pregnant people. So those are like the three basic type of diabetes mellitus we have. Then you have to talk about the pathophysiology of diabetes mellitus, and you are trying to write a research. There is complication, there is symptoms, the three P's. Abi now, polydipsia, polyphagia, you understand? So you this thing is actually quite large because the topic is not specific. You're actually picking a subject rather than picking a topic a topic. But if you are now dealing with a research topic, now you can see an example here now. Effect of food care education on prevention of diabetic foot ulcers among patients attending outpatient clinic at General Hospital Lagos. Now we can see that this topic is actually very specific. How is it specific? What do I mean by it is specific? We are only dealing with the effect of foot care education, the effect of foot care education. So it is specific. We are not picking the whole of diabetes mellitus again. We've only limited it to the effect of the foot care education. For diabetic patients, if they have injury or sores, ulcers in extremities, especially the lower extremities of their body, it heals very slow. You understand? So that leads to commonly foot ulcers. So we are trying to know the kind of education you give to your patients that have diabetic foot ulcers. You want to know the effect of the education. Is the education, the counseling you give them, is it helping them? Is it improving it? You see now that this is bit more specific and measurable, and it is visible. You understand? It is visible, it is not as broad as it was before. So to actually come about a good research topic, there's something we call the anatomy of a research topic. Please, are we following? If you are still with me, can I see you type in the comment section so I can know that we are still together? Please, are we still together? If you can still hear me and you are following, just you can just type so I can know, so I can proceed. All right, thank you. So for anatomy of a research topic, we have variables, we have population, and we have the setting. The variables, now the variables have to do with what exactly are you measuring? What exactly are you measuring? If you look at the research topic we just looked at, effect of foot care education, what are you measuring exactly? You are trying to measure the effect of foot care education. So that is like your variable. But then we can have more than a variable in a research topic. We are still going to get to that. So that is what you are measuring. Then you have your population, which is who you are studying. In this topic, those you are trying to study, they are foot ulcer patients, among patients attending outpatient clinic, patients attending the outpatient clinic. That is your what? That is your population. Those are the people you are trying to study. Then now when we come to setting, setting has to do with where exactly is it happening. Are we doing this in if you look at this topic now, General Hospital at Lagos, that is our setting. Alright. So what now is a variable? Let us look into this anatomy of a good research topic properly now. What is a variable now? The word variable actually comes from the word vary. Now when we talk about vary, from the word vary, it means to change, for something to change. That is what variable. So any quality, attribute or characteristics of a person, thing that can change, that can take different values, is actually called a variable. Let me explain with the examples I listed there. We have temperature. The normal room temperature is 35 na, normal body temperature. Normal room temperature is different. Normal body temperature is 35, abi 35 to 37.5 plus or minus. So let's use water. Let's use water. Don't let me, or we can still use that temperature. If someone is feeling feverish, you understand, and there's pyrexia, the body temperature increases to probably 39, 38, then we know that the person is sick. But now that temperature has changed from a normal level to an abnormal level now. That means temperature varies now. So temperature, if you are trying to carry out a research and temperature is in that topic, temperature can be a variable because it did what? It changed. Pain can be small, it can be moderate, it can be increased. You know that that's the fifth vital sign now, abi? Very important. All these council people they used to ask. So pain, people may say that presently, they used to ask them if you are with a doctor, they will tell you that on a scale of 1 to 10 or on a scale of 1 to 5, how painful is this thing? So and you tell them okay, the pain is probably 6/10, they will know that okay, this pain is much. If you say like 2/10, they will know that okay, it's not that painful. So that is also a variable because it can change. Level of pain can change. Then knowledge too. And this is very important for those that will have knowledge in their research topic. Knowledge can be little, it can be moderate, it can be high. Because when you are now saying that assessing the knowledge, those research topics are actually very plenty. I've seen a lot of topics like that, assessing the knowledge. When you are now assessing that knowledge in your questionnaire should be able to tell us if that knowledge is actually much, moderate, or very low. All right, so let's move on. So to the types of variables now, to the types of variables, we have independent variable, and I denoted that with IV. It's quite popular. It's quite popular, IV. Now, when we are talking of independent variable, from the word independent, that means it can actually do what? It can stand alone. It can stand alone. An independent variable can stand alone, and we usually call it the cause. We call it the cause, CAUSE. The dependent variable is it depends on the independent variable, and we call it effect. Let me explain what cause and effect relationship is. Okay, let's say you are at home now during the Christmas break. When you were at home, you wanted to go out around 7 p.m. and your dad says no, it is already getting late, don't do what? Don't go out. Dat if you come back and if you still want to go, if you do not come back before 8 p.m, you will not enter dat house dat night. But den you went ahead and you went out, and unfortunately there was delay, so you returned by 9 p.m. Now cause and effect. The effect is dat you will not sleep in dat house dat day because they've already explained it. So your effect depends on the on your cause. Had it been you did not go outside dat night, the effect will not be dat you will not sleep in dat house. I'm trying to explain because it is actually very important for you to be able to identify your independent variable and your dependent variable. You need to be able to identify it because once you are able to identify it, then you'll be able to break it down, and we call those measurable indicators, but that's not for today's class. But if you cannot identify your IV and DV at this level, it will be very difficult for you to be able to break it down into measurable indicators. Then the third type of variable I added here is demographic variables. Now they don't really teach this, they don't really teach it, but the reason why I added it is because most people, when you want to write your hypothesis, most of the people tẹ́ bá ti lè gbégbági along the line, you will now start saying demographic, socio-demographic factors is this, is that, which is not right, but you need to understand socio-demographic. Now socio-demographic are things like age, sex, gender, employment, the job the person is doing, you understand. So those are socio-demographic variables too, and they can also change. Alright, so look at this example here. The example is effect of honey dressing on wound healing. Honey dressing on wound healing. You need to be able to identify the cause and what and the effect. the cause and what? And the effect. Now, effect of what? What is affecting what? That is how you should start. Honey dressing is affecting wound healing. Honey dressing is the one affecting wound healing. So the effect will be what? Wound healing. The cause will be honey dressing. You understand now? So if honey dressing is your cause, the one that is affecting wound healing, then that means it is your independent variable. I hope we are still together. Let me say it in another way. I cannot actually receive audio feedback. So let me try. So right, I'm sorry. Um, I think we are back now. Yes, I think we are back now. So it is that honey. So the healing of the wound depends on what? On the agent you are using to treat the wound. So the agent you are using to treat the wound is actually the cause. You understand now? We are still going to look at a lot more examples along the line. So let's move on. Let's look at the population. Now, population refers to the other time we said who, am I right? Who, that's the population. So the population refers to the specific group of people you are studying. Specific group of people you are studying. It must be specific and it must be accessible. Now, for specificity now, if you in your research topic, if you say that you are carrying out a study Ekiti state completely, you know that is very broad. In fact, there is no exact distinction. It is just too broad. You did not narrow it down. And when your population is actually very large, when you get to your chapter 3 and you are trying to calculate your sample size now, you have problem. Because when you use that Yaro Yamin's formula, you understand me, you start getting large values. Now when you take it to your supervisor will say that go and reduce the number, especially if you are now going to use a questionnaire, printed questionnaire now. If you are going to use a printed questionnaire, your the money you are going to spend on printing it out will be much. So that is the reason why you need to make it as specific as possible. Look at the examples of the ones I said it is specific. Primigravida mothers. This is letting you to know that these mothers, they are not what? They are not multigravid. You understand? They are preemie, first time. Elderly patient with type 2 diabetes. So that means that we are not dealing with the A part. Those that their diabetes is as a result of autoimmune disease. We are dealing with type 2, and type 2 is their body is not responding properly to insulin again. Elderly patients with type 2. So you know now that for your population only those with type 2 diabetes, that is those you are using. You are not using those with type 1 diabetes. You are not using those with the third one is nursing students in their final year. If you want to carry out the research in your school, you want to use nursing student, faculty of nursing or department of nursing. You understand me now? You now say that you want to use nursing students at, let's say, Bowen University. What you are trying to say now is that you want to use all of them from 100 level to 500 to 500 level. Now that population is already very large. By the time you start calculating your, what's it called now, your sample, you will still be getting very very high values. You understand now? But if you narrow it down and you make it specific, you say that you are only, you understand me, then you know that you are only using probably 300 level students alone, third year students alone for college, while 500 levels those in the university. So that is specific. Let's say that let's say that you want to use patients with Ebola or COVID-19 attending clinic at LAUTECH Teaching Hospital Ogbomoso. Now your population is not accessible. because I am very sure that LAUTECH Teaching Hospital does not have any current Ebola case. In fact, if there is Ebola presently, that is like a epidemic ni, abi now. There will be lockdown everywhere, you understand. So that your population is not accessible, is not, even if you see someone with Ebola, you will not want to move close to the person and say that sir, mo ń ṣe research, I'm trying to carry out a research on Ebola patient, will you help me to fill my form? Personally, you also, you are gone, you understand. So your population also must be something that is very accessible, very accessible. Alright, let's move on. So the setting now, the setting is the location of the study. The setting is the location of the study. Don't confuse population and setting. Don't confuse them. Population is the who. Who exactly are you using? You understand? Population is who, while setting is where. Where. Population is who, setting and your variable is what. What, who, where. What, who, where. Your variable is what, your population is who, and your setting is where. You understand? So if you now want to carry out a research, you say that you want to carry out a research um assessment of knowledge of glaucoma among patients in Nigeria. What you are trying to do is that you want to everybody that has glaucoma in Nigeria, you want to use them. That is like your population. Now if you now want to calculate your sample size, I'm sure that you will still have million. If you are, not that there are no studies like this, there are actually studies like this, but they are beyond the scope of undergraduate studies. You understand? Probably when you may want to take on a more challenging research setting, you understand. But for this level, just use something that is very niche down, something not broad, something close to you, so that you'll be able to access it properly. Now, let's talk about okay, there is another example there. We have Beta in Lagos State, but Lagos State is still a very large, that's a whole state. That is still very wide actually. That is still very wide. But if you are now saying that you are using selected primary healthcare centers in, look at this example, Alimo, this is perfect because personally it is what? Selected primary healthcare center. That means you are even the one that is selecting the, for example now in Ogbomoso there are a lot of primary healthcare center. In the northern part of Ogbomoso north, the local government area there, we have about 6 there. Yes, about 6, it can be more, I'm not sure. Now if you now want to carry out your research, you may say that you want to use just 3. You want to use Baki, you want to names like that, Ibrahim Taiwo, those are the common names around that place, yeah. So you are the one that will select it, that okay, I'm using this and this. So this setting is very niche down. Selected primary health Omosho local government area, Lagos. So this is like perfect for a research setting. Please, if you are still together, let us type in the comment section, and if you have questions, you can start dropping your question. All right. So let's look at research topic cheat sheet. Now, the reason why I created this was because to still be difficult for some people. To really formulate research topic, you need to actually understand what IVDV, in fact we still have others like moderating variable, confounding variables, intervening variables, you understand now. But then so that your work can be fast, because this class is practically oriented, you understand now. So I brought together some formulas that if you use the formula, you research topic, you should be able to arrive at a research topic. That's the reason why I did this. So Effect of IV, the first formula, effect of IV on DV among your population in your setting, on DV among your population in the setting you want to make use of. So you can see the example, there. So your IV, independent variable, and your DV. Let's read out the example together. Effect of warm compress therapy on perineal pain. Warm compress therapy on perineal pain. What is affecting what? Warm compress therapy is the one affecting perineal pain. Dat means perineal pain is depending on what? Warm compress therapy. Dat makes perineal pain your what? Your IV. Perineal pain is your IV. So dis will be your IV, your DV rather. Very sorry for dat mistake. Your DV. Perineal pain will be your DV because it is depending on what? On warm compress therapy. It is depending on your warm compress therapy. So dis one independent variable. So the effect of warm compress therapy on what? Perineal pain among population. Now what's your population? Postpartum woman. Postpartum women. So dis is your population here. So you are not using all women. You are not using pipu at ten ding an ten atal. You are using only those that they are in kí la tiẹ̀ tún máa ń pè é o, what's this, but during their postpartum phase they are done giving birth, you understand, that phase after parturition in short. So those are the people you are making use of. So that's your population. At General Hospital Ikorodu, that is your what? That is your setting. General Hospital Ikorodu. That means you are not using people at Ekiti State University Teaching Hospital because that is not your setting. General Hospital, the General Hospital at Ikorodu is your what? Is your setting. That's the where. Who is what? Who is postpartum women at General Hospital. So what you can do with this formula is that you can just think, what do I want to write about? Effect of what? Effect of you can just think about any independent variable and your dependent variable, and you can use it to actually get what? A topic. You understand? Of long shift hours on nurses health, on patient outcomes, among, now you now tell us the population, patients in the emergency ward at Bowen University Teaching Hospital Ogbomoso. Effect of what? Long shift hours. Nurses long shift hours on what? What's your dependent variable? Patient health outcome is depending. Look for different variables and just put it in the position of IV, DV. Then you put a population and a setting, and you actually have your research topic. Please, are we still together? All right. So let's continue. So Formula 2. Formula 2 is actually more technical, but the reason why I included it is that I used to see it a lot of time. Personally, I will not advise you to use it. All this KAP, we call it KAP. Knowledge, attitude and practice. Knowledge, attitude and practice. Then you pick a concept or health issue among population and in a setting. All right. A call came in and it is possible I was disconnected. Knowledge, attitude and practice. Knowledge, attitude and practice. Look at the example we have there. The example there is knowledge and attitude. knowledge and attitude regarding exclusive breastfeeding among primigravida mothers. Knowledge and attitude regarding exclusive breastfeeding. So exclusive breastfeeding is the concept. Exclusive breastfeeding now is the concept. You understand? Among primigravida mothers, that is your what? Population. Primigravida mothers, that's your antenatal clinic at UCH Ibadan, that's your setting, that's your research setting. You understand now? So you can actually use this to formulate a topic for yourself. You can only limit yourself to knowledge and attitude. You can only deal with knowledge and practice. You can do knowledge, attitude and practice, and you can do attitude and that should actually help. Alright, let's move on to the third one. So third one is relationship between variable A and variable B among population in a setting. Relationship, now this is also like cause and effect, so it will be easy for you to identify your IV and your DV. Actually for this one too, you can still identify your IV and your DV. It is still easy, but because this is like most of you are hearing this for the first time, so I don't want to complicate it. You understand? But this research topic actually has IV and DV, the implied in it. It is implied. It is an implied IV, but the DV is there. You understand? The DV is there, and that will be their attitude on exclusive breastfeeding. You understand? So now let's focus on this relationship between workplace stress and job satisfaction. What this topic is just saying is that what is the relationship between workplace stress and job satisfaction? How is workplace stress, how is it affecting job satisfaction? So what is affecting what like that? Workplace stress is affecting what? Job satisfaction. So you can say that workplace stress is what? Is your IV, because it is the cause. While job satisfaction is your DV and it's your variable B is your DV. Staff nurses are your what? Population. Staff nurses are your population. That's your population. Staff nurses are your what? Lagos University Teaching Hospital. So this is your setting. That's your setting. That's the setting. Alright. I'm sorry. Now the fourth formula is factors influencing DV among population. Now we said factors influencing non-adherence to antiretroviral therapy. My hand is not alright. So this is your DV, dependent variable, influencing non-adherence to antiretroviral therapy. Antiretroviral therapy, this heart clinic, these people have what's it called now? HIV/AIDS. So you want to know why some of them do not obey, they do not comply to the instructions you give them, that this is your, so you want to know the factors that are influencing those factors. Probably it is income. Well, there are some health schemes. So in some places it is actually free. In some places it is actually free. They give them free drugs, you get expensive. They give them free drugs, you get expensive. It is the government that is putting to sell it. The therapy, you know that income will be one of the factors that will prevent people to adhere to their therapy. So income will be one of the factors. So but you are not among HIV patients, HIV positive patients. That is your what? That is your who? HIV positive patient. That means if you see someone with that is HIV negative, you cannot use the person for your research. You cannot give the person your questionnaire. You understand now? In selected centers in Abuja, in fact this setting is still not so narrowed down. It is not so narrowed down because selected centers, well, because it is selected, that means you'll be the one selecting it, and you will actually tell us in your scope of the study the centers you have selected. All right. So then the fifth formula, there are actually six formulas, but there are six. There I added just five to this slide. So prevalence and management of health condition among a population in a specific setting of health condition. You for this formula, just like KAP, knowledge, attitude and practice, abi now, you can also just pick only prevalence, and you can sometimes you can pick only management, and you can pick the two. It's your choice. So for this example, we picked only what? Prevalence. Prevalence of pregnancy-induced hypertension, pregnancy-induced hypertension, your preeclampsia, like that abi. Pregnancy-induced hypertension, you want to know how prevalent it is. So prevalence of pregnancy-induced hypertension among women attending, this is your population. Who? Women attending an ten atal care in clinic of the hospital you are making use of, or the in this place we are using a PHC. In that place, you only want to look pregnancy induced hypertension among them. All of them cannot have pregnancy induced hypertension, but you'll be picking only those with pregnancy induced hypertension. You understand now? So you want to check how prevalent it is. Báwo ló ṣe pọ̀ tó is prevalence. Understand? Prevalence of pregnancy induced hypertension among women attending an ten atal care. That's your population. And your setting is what? Primary health centers, Ogun State. Primary health centers. In fact, this setting is also quite large, but you can just put selected primary health center, then you include a local government. I'm not from Ogun State. I don't really know the local government areas in Ogun State, but it can just be like in selected primary health centers in so local government area, Ogun State. So that would be your setting. There is a rule that your research topic should not be more than 20 to I think 23, 22, 23 words. The word count for your research topic. It should not, some still accept 18 you get, but the safe space is just 20 words to 22 words, 20 words to 22 words. Alright, so aspect is more on alright, so the other aspect is reality check. Now I've taught us how to actually draft or craft a research topic. If you use any of those five formulas, you should be able to arrive at topics. So formulating a research topic should not be difficult any longer again. It should not be difficult. You can just pick any of the formula and apply it, and you will arrive at a research topic. Even if you want to formulate 15, you need to submit just three. Pick three, go and submit it to your supervisor. Anyone your supervisor approves, then we know that we continue with that. And sincerely, I would appreciate if we could do that before the next class, because from the next class we are going to be looking into all dis background of the study, you understand, background of the study, significance of the study, all those things, operational definition of terms, things like. If you don't have a topic yet by then, you may not be able to relate properly or know how to apply what you will be taught. So why do they, before you actually pick a research topic, there are things you need to check, and that's the visibility, and I've mentioned that briefly earlier, that is your this your research topic that you are going to pick, is this something you can do? Is this something you can do within specific time? Don't go and pick a research topic that you will need like 6 months before you can carry it out. For example now, a topic like long term effects of exclusive breastfeeding on intelligence quotient. How do you want to measure the long term effect of exclusive breastfeeding on intelligent IQ of children within short term? That's not possible actually. So a topic like that, you cannot even finish it in 6 months. Cause 6 month old child cannot take IQ, cannot sit down for IQ test yet. You get, those are long term. For your undergraduate studies, don't pick topics like that. Den topics that we, if you are doing an experimental study, although you can't do that, you should not even try it. MLS students mostly do that. You will need to hire someone that will collect blood samples for you. You will pay to use the lab. You will pay to those that will help you to analyze the results, things like that. Even the normal research you are still writing, your data analysis, your chapter 4 or 5, most of the time you outsource it to those that can do it, and you will still spend money. So don't go and pick a topic that will increase your budget. You understand? That is one of the things you should reduce. That is one of the things you should look into before you pick a topic. Also, availability of record. Don't pick a topic that you will not be able to find citations on. Pick topics that people have worked on before, so that you'll be able to get current citation. You can't go beyond past 5 years. You should just between 5 years. This is 2026, that means they will be expecting your citations to be between 2021 to 2026. And for you to actually, we are still in January now, and the research work that has already been published in this 2026 will still be few. You understand? So 2026 is actually like somehow out of it. 2025, 2024, 2023, 22, 21, those will be like your strong points for citation. Also, your research should not cause harm to people. For example now, you out a research on people in ICU. How do you even want to administer the questionnaire to them? Someone in coma, you want to, that is not possible too. So your research, you should, those are the ethics. And in your chapter 3, you are going to write on that too, the ethical things you followed. You understand? Then don't go and pick a research topic that is too common too. There are a lot of variables. Change things, manipulate it, swap it, just push it up so that it will not look like you can still be doing the same work someone else did, but it is the English you will use that will be different. You understand? So I think we've come to the end of the class for today, and if you have any question now, we can actually start dropping the question so I can attend to them. Questions, please. I don't want the class to extend beyond 1 hour. I actually don't want the class to extend beyond an hour. So please, if you have questions. Now, this is the action step for students. Before the next class, draft out three research topic. So one should be like a clinical topic, one should be a public health topic, one should be like an administrative topic or education topic. You understand? So draft them out, look for the IV in your topic, independent variable, and the DV in your topic, the dependent. Identify your population and your setting. You understand? So thank you very much. I'll be waiting for our questions. And once it's 8 o'clock, I'm going to stop the live streaming by the grace of God. All right, so questions.